This is Dr. Dave Barnhart of Behavioral Sciences of Alabama. Our intensive outpatient program for obsessive-compulsive and related disorders is an institutional affiliate of the International Obsessive-Compulsive Foundation. We use exposure and response prevention as an integral component of most of our treatments of OCD. We refer to exposure and response prevention as ERP, and we refer to obsessive-compulsive disorder as OCD throughout this presentation. OCD may be exhibited in a variety of symptoms called obsessions and compulsions, and the treatment design must be tailored to the individual. Obsessions are thoughts, images, or impulses that occur over and over again and seem outside the person's control. Individuals with OCD do not want to have these thoughts and find them disturbing. In many, but not all cases, people with OCD realize that these thoughts don't make any sense. Obsessions are typically accompanied by feelings that range from mild to intense discomfort, such as fear, disgust, doubt, dread, or a feeling that things have to be done in a way that is just right. In the context of OCD, obsessions are time-consuming and get in the way of important activities the person values. Common obsessions include thoughts about such things as body fluids, germs, disease, environmental contaminants, or dirt. People with OCD may fear acting on an impulse to harm themselves, harm others. They may fear violent or horrific images that enter their mind. They may have a fear of blurting out obscenities or insults and a fear of stealing things. They may have concern over evenness or exactness, concern with the need to know or remember. They may fear losing or forgetting important information. Those with hoarding compulsion may fear throwing something out or experience an inability to decide whether to keep or discard things, or fear losing things. They may have an unexplained feeling of attachment for objects for which they may have a use or a need in the future, or they may forget an important part of their life experience if they discard things. Many OCD sufferers fear having forbidden or perverse sexual thoughts or images, forbidden or perverse sexual impulses about others, obsessions about homosexuality, sexual obsessions that involve children or incest, or obsessions about aggressive sexual behavior toward others. They have intrusive thoughts, or they may have images that enter their minds about things that they are afraid to tell anyone about. They don't realize they are suffering with OCD and often think they are horrible people for having these thoughts. A type of OCD, sometimes referred to as scrupulosity, involves concern with offending God, or concern with blasphemy, or excessive concern with right or wrong, or morality. Some sufferers have health anxiety or a concern with getting a physical illness or disease. Some have superstitious ideas about lucky or unlucky numbers or colors. Compulsions are the second part of obsessive-compulsive disorder. These are repetitive behaviors or thoughts that a person uses with the intention of neutralizing, counteracting, or making their obsessions go away. Some believe they must perform a compulsion in order to keep bad things from happening. People with OCD realize this is only a temporary solution, but without a better way to cope, they rely on the compulsion as a temporary escape. Compulsions can also include avoiding situations that trigger obsessions. Compulsions are time-consuming and get in the way of important activities the person values. Common compulsions include washing hands excessively or in a certain way, excessive showering, bathing, toothbrushing, grooming, or toilet routines. Some OCD sufferers have compulsions that involve cleaning household items or other objects excessively, or doing other things to prevent or remove contact with contaminants. They may ask family members or friends to handle items so they can personally avoid coming into contact with them. People with a fear of harming others may check that they have not or will not harm others. They may check that they did not or will not harm themselves. Check that nothing terrible happened, or check that they did not make a mistake. They may spend extra time rereading or rewriting to make sure they have not made a mistake or missed something important. They may repeat routine activities, repeat body movements like tapping, touching, or blinking, repeat activities in multiples, do a mental review of events, excessively pray to prevent harm, count while performing a task to end on a good, right, or a safe number, attempt to cancel or undo by replacing a bad word or thought with a good word or thought. Many sufferers spend excessive time putting things in order or arranging things until it feels right, telling, asking, or confessing to get reassurance. One hallmark of OCD is avoiding situations that might trigger an obsession. Examples of related disorders we treat include body dysmorphic disorder, hoarding, hair pulling disorder or trichotillomania, skin picking, otherwise known as dermatillomania, and excoriation disorder. I hope you found this introduction to OCD helpful. To learn about exposure and response prevention, open the links providing examples of how we use exposure and response prevention when we treat OCD.